California Governor Gavin Newsom laid out 6 key indicators that California will need to accomplish before fully reopening. Contact tracing is a huge part of that, figuring out who COVID-19 positive patients were in touch with and when. And the state is investing in large-scale initiatives, one of which is with UCSF. To learn more, I spoke with Dr. Mike Reid, who leads the program.
I think there's a lot of interest in the role of apps. So Google and Apple have developed these smartphone apps. Look, I think they have a small role to play. If information on your phone about your proximity to somebody with COVID helps inform how you respond, I think that's a great thing. But ultimately, the bigger effort has to be one that is a public health run initiative. If we're ever going to move beyond shelter in place, we anticipate that as people go about their daily lives again, we'll see more cases, right? And so we plan on mobilizing a much bigger army of people to do this. There's a team of professionals within any Department of Public Health, but certainly here in San Francisco, that get on the phone with those individuals that have been diagnosed. And first of all, they ask them, how are you? Are you doing okay? But then they want to understand, when did they fall ill? And after they fell ill, who did they come into contact with? So in that case investigation phone call, the case investigator will enumerate a long list of contacts. Those contacts, those individuals, their phone numbers are pushed to my team. And then we reach out to those contacts one by one and we say, hey, we understand that you had close contact with an individual who we now know to be suffering from COVID-19. And you need to know that because you are in close contact with that individual, there's a risk that you could develop symptoms. And so in San Francisco, it's just a thrill to see how our citizens have mobilized to this effort. We're training people from the city attorney's office. We're training librarians, retired physicians and nurses, medical students, people from diverse backgrounds that have agreed to participate in training. And then as we move beyond shelter in place, if we're doing a really good job of case detection and contact tracing, then we're never going to see that huge exponential increase in incidents that is really hard to control. And that's why these things have to be in place moving forward.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.